Today we're going to be updating the exam of the gum tissue. And the way we do that is we have our probe here that we slide between tooth and gum and we measure to the attachment. As long as that's a 1, 2, or 3 and the gums don't bleed, it's considered healthy. When we look at your X-ray here around the roots of the teeth, this is the bone and this is right where it should be. If we get a 1, 2, or 3 but the gums bleed, it's gingivitis, basically an infection of the gum tissue. The bacteria that's in plaque gets in this space here, it inflames the gums, causes the bleeding. Still no bone loss on the X-ray. If we see enough bleeding, we recommend treating gingivitis, because if you allow that to go on, the inflammation actually breaks down this attachment here, you start to get 4s. Anything over 3, when you brush and floss at home, you can't get to the bottom of. We call those pockets. That's it's early periodontal disease. It's an infection of the bone. If you compare this X-ray to this one, you can see we're losing a little bone height here. The gums are more red instead of a healthy pink. If you don't treat at the early stage, that just progresses. Breaking down this attachment, we get 5s and 6s. That's moderate periodontal disease. You can definitely see the puffiness and inflammation of these gums here. We have more bone loss on the X-ray. And if you don't treat at the moderate stage, it goes down to advanced. That's 7 millimeters and beyond. You got 50% or more bone loss. The teeth can be mobile, bad odor, bad taste. Sometimes there's pus. You're just losing all the support to your teeth. The farther down in periodontal disease you progress, the harder it is to treat. That's why we recommend treating if we see gingivitis. Where do you think that you fall on this chart here today?
I'm up here.
Okay, you're right. You do have quite a few healthy areas, but back here in these molars, we're starting to get some 4s and 5s. Just a couple of teeth in each area. They are bleeding. That's telling me that you do have an infection in the gum and the bone. I'd like to show you a non-surgical way to treat that. The way that we do this, we're going to propose a level 3 periodontal therapy. Root planing basically means we're going to go in there and clean out the infection. We're going to get it nice and smooth, get rid of the bacteria that gets rid of the inflammation. We're hoping that we can get those 4s and 5s to shrink down to 3 and below, which you can maintain at home. The 5s that you have here, we're going to put a little antibiotic gel in. It helps us kill the bacteria. We're going to give you a Sonicare toothbrush so that you have the tools that you need at home to keep things under control, because in between your visits, it's all you. Uses the same technology as my ultrasonic that I'm going to use during your root planing. That vibration helps kill the bacteria.
Okay.
There's lots of contributing risk factors here. Like in your case, you're a smoker. That could be contributing.
Absolutely.
And then another reason it's important to treat your periodontal disease, your infection, it's not just to keep your teeth, but there's a lot of oral systemic links here. It contributes to heart disease, it complicates diabetes, high blood pressure, all those kinds of things. They're kind of interrelated.
Okay.
I think we'd have a good prognosis. No surgery would be needed. Hopefully we can keep you from getting extractions if we get that under control. Take a couple of hours. We're going to have you nice and numb to keep you comfortable.
Okay.
And your total fee is, and your insurance covers, and that's going to leave you with this. One more thing I want to tell you is it's real important. It takes 3 months for that bacteria below the gum line to start breaking things down again. So we like to get you in for what's called a periodontal maintenance. That's what your cleanings from here on out would be called, so that we can keep the disease under control. So you can accept or decline. And what questions do you have for me?
Well, I guess I really don't have too many questions. I was just taking a look over here. I really like the toothbrush, so I think I accept your treatment.
Very good. Well, we're looking forward to treating you.
Great.